Go.
Okay, how many people do you see on average in the ICU as a nurse?
There's usually about 20 patients. It could hold 20 patients. It kind of just depended on the workflow, like how many people were sick. As a rule, people only had 1 or 2 patients per nurse.
Was that like 20 per like day or what?
It depended.
Okay.
Some days there could be as few as 5 people in there, and other days it could be as many as 20. So.
Okay. Are there any signs or red flags to discover someone addicted to the prescription drugs? And if so, what are a few?
Yes, there are many signs. On an outpatient basis, people who have many physicians prescribing them medications, people who are visiting many pharmacies rather than just one, people in a hospital setting will ask for drugs by name, which the most people do not know certain pain medications. They would be like, oh, I'm allergic to ibuprofen and Tylenol, and ask for something like Dilaudid by name. Now for you, you probably don't even know Dilaudid is a pain medicine. Most people don't. So somebody, that would be a red flag. Or people would watch the clock and be like, oh, I'm in 10 out of 10 of pain at exactly 4 hours, when they know that they could have more. It's things like that.
Okay. Why do you think prescription drugs are so addictive?
Because they work on the part of your brain that kind of, it makes you feel good, I suppose. Like, it stops the pain, but at the same time, it gives you a feeling of euphoria, and people like that.
Okay, who do you think is abusing prescription drugs, like a common, like...
That's kind of hard to say. I mean,
Okay.
there's a lot of people that you wouldn't expect to be taking prescription pain medicine. I think a lot of people are able to hide it very well. People who are at risk are definitely chronic pain people, patients, because they are prescribed the medications, and over time they do build up a tolerance.
Okay. So how do you think people become addicted to them?
Like I said,